I am Maria Gonzalez Collis. I will start today's presentation by introducing Mariah. She's a volunteer at NAMI, um, and I also work with her as well as a volunteer with NAMI. But I'll let her introduce herself and then tell you a little bit about the program.
Hello, good morning, everybody. I'm Mariah Naki, the Education Director for NAMI Gulf Coast. Today, I'm going to share with you a little bit about NAMI Gulf Coast and our Ending the Silence program. And now, for those of you who are unfamiliar with our agency, we are the National Alliance on Mental Illness. We serve both Brazoria and Galveston County by providing free education programs, support services, and resources for families and individuals affected by a mental health condition. So one of those education programs that I want to talk about is our Ending the Silence program. Education is key. Our education training is an evidence-based program designed to start the conversation about mental health and suicide. This is a free 50-minute program geared for 3 types of audiences. So for students who are middle school and up or young adults, for staff members that can include teachers, counselors, or the other organizations, but also family members as well. Our audience members really learn to become an expert observers of the warning signs often associated with mental health conditions and suicide, how to reach out and respond to an individual facing challenges, and how to provide them with resources and support for treatment. The program is also led by 2 individuals who have their own lived experience with a mental health condition, whether that's within themselves or a family member. I myself am a family member and I am a presenter for our Ending the Silence program as well. And I speak from my own personal experience as a family member of a sister who is living with bipolar, and how difficult it has been in our family to work with her and find coping strategies for her and limit setting and just dealing with the very high highs and low lows when it comes to her bipolar. So it's a really great presentation and it's peer led, and we really want to engage in a conversation with our attendees to really just start the conversation about mental health conditions and reduce the stigma often associated with them. So it's important now more than ever to learn the warning signs, especially with COVID-19 that has impacted our mental health substantially. And this Ending the Silence program was once in person, but now we're doing them online like we are right now on Zoom virtually. So everybody can watch from the safety of their homes. And so if you would like an Ending the Silence program for your group of students, if you have family members that would like to attend as well, just reach out to us. Our phone number is on the screen. You can also use your phone to scan the little barcode as well to find more information and how to schedule a presentation for yourself. Thank you.
Thank you, Mariah, for sharing that information. I know that that will be a great presentation for students and parents and anybody, who needs that service. But thank you for sharing. Good morning, everybody. I'm going to go ahead and start here. Of course, today's topics is about hidden signs of teen depression for parents, and we really emphasize about, and we'll have more description about what we're going to be talking about. But one of the first things I want to start is talking about our program. Again, my name is Maria Gonzalez Collis. I am one of the crisis counselors with Texas Recovering Together crisis counseling program. And then I have my colleague, Lisa Taylor, who is also a crisis counselor with the same program, who will be presenting the rest of the presentation. Some of the services we do provide are free. We offer free and confidential services for anyone affected by COVID-19 in Brazoria and Galveston County. Now, when I say affected, we're not talking about just the impact of getting sick, but just affected whether you lost your job, or had a family member who got sick. I mean, so, at the end of the day, we all have been affected by this pandemic in some form or another. And so we are here to provide those services to everyone that's been affected. So I think you should know that, you don't, everybody is in some direct form impacted by this. You know, one of the things I always think about is, you know, Lisa and I get to work from home, and, you know, although that's a pretty cool benefit, you know, but we miss having that socialization, connection with other people, as we know that other people feel the same way. But, you know, safety is first of us and others as well. So for that reason, our services are offered to all ages and diverse groups, including teenagers, seniors, veterans, parents, people with disability, and individuals experience homelessness. Of course, I want to emphasize this as well. This is not a traditional counseling or psychotherapy. However, we do have trained counselors who offer short-term social emotional support during this pandemic. Another service we are providing as well is, like we're doing today, we are available to provide workshops and presentations to organizations on a variety of mental health related topics, including things like self-care, stress management, coping skills, task organization, problem solving, and much, much more. All our services currently are virtual and include individual and group counseling. Individual counseling could entail working on reducing anxiety, finding balance, and getting support during crisis such as this pandemic. Group counseling could include support groups, psychoeducational groups, and workforce groups as well. We also provide community network and support assessments and referrals, resources, development, and distributions of educational materials. So I have added our phone number on the chat box, but we'll provide this information again at the end of the presentation. One of the things I do want to mention at the end, if you do have questions, go ahead and put them on the chat box, and we'll be happy to answer to them. Otherwise, if you want to just ask us the questions, we do have time for at the end of this presentation. So thank you for listening, and I just want to go ahead and turn it over to Lisa.
Hi, good morning, everyone. I am Lisa Taylor. I'm one of the crisis counselors here with Maria, and today we're going to be talking about the hidden signs of depression. We have a little bit of information about mental illness, but like Mariah said, if you're interested in learning more about mental illness, being a support and an ally, please reach out to NAMI Gulf Coast. They have an excellent program, Ending the Silence. I've actually participated in that, so it was really great. And you guys should do that as well. So what is mental illness? According to the American Psychiatric Association, mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Mental illnesses are associated with distress and/or problems functioning in social, work, or family activities. Mental health conditions are common among teens and young adults. 50% of all lifetime mental illness developed by 14, and about 75% develop by age 24. So the three most common diagnoses of mental illness in teens are depression, anxiety, and social phobia. And we'll be talking a little bit about each of those in this presentation. Symptoms of teen depression. According to the American Psychiatric Association, depression, or major depressive disorder, is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it's also treatable. Depression causes feelings of sadness and loss of interest in activities you enjoyed. It can lead to a variety of emotional and physical problems, and can decrease your ability to function in life, at work, and at home. Teen depression is more than just moodiness, more than occasional sadness or some adolescent rite of passage caused by hormones. Depression is serious, and it can affect every area of the teen's life as well: their health, their academic success, their relationships, and how they value themselves. Symptoms of teen depression are feeling persistently sad, trouble feeling happy. Some teens may not have this issue, but if your teen seems to go from very sad to extremely happy, your teen may be experiencing bipolar disorder. Lack of pleasure. You may sometimes think your kids hate everything, but they don't really. And if they do, then they may be experiencing some depression. Feelings of guilt, shame, worthlessness, or humiliation. Feeling anxious. Do they seem to worry a lot? Difficulty falling asleep or staying asleep. Changes in eating habits. Are they eating too much or too little? Thoughts of suicide or death and anger. Now, some teens with depression may try to hide the signs from others, or they may not even realize that they have depression. Although the typical symptoms of depression, such as sadness and hopelessness, can be easy to recognize, there are symptoms that may be less obvious. Signs to look out for. The symptoms of teen depression are similar to those of adult depression. However, teens may not always share their emotions with others, which means that parents or caregivers may only notice a pattern of anger or withdrawal because those are more extreme, right? They're more noticeable. But some signs that they may be experiencing depression are sudden abandonment of once beloved activities, spending the majority of their time alone, neglecting friends or romantic partner, unexplained anger that goes beyond typical adolescent rebellion, a sudden change in school performance, sleeping significantly more than usual or doing unusual times, complaining about various aches and pains that have no apparent medical cause. So we say the hidden signs of, right? Like you might notice if your teen is showing the signs that I just mentioned, but maybe your teen is busy, maybe your teen is working a lot or involved in a lot of activities. What if your teen studies and a lot? Can they be depressed? What if my teen is just sitting in the living room and they're watching TV or they seem engaged with the family? It's a pandemic, right? So is that abnormal? Could be a sign of depression. Signs like can be subtle. They can be very subtle, like watching TV. They may be avoiding spending time with their friends, or that teen that's involved with all the activities, that's studying, they may be overcompensating for feelings of worthlessness. So it may not look like depression at first glance, but it still may be depression. So is it just depression or is it teen moodiness? Teen depression, some of the parents and caregivers may mistake depression for typical teen moodiness. That's common. But some differences may include teens may have a lot of mood swings. It's normal or common for them to shift towards happy or elated behavior. But teens with depression may display an extreme pattern of anger or sadness or withdrawal. Typically, teens will try to establish an identity separate from that of their family. They may not enjoy family events like they used to, or they may be angry with their parents or caregivers. However, they will try to form those bonds and establish that new identity with their friends and their peers. That's typical. Teens with depression, on the other hand, they may withdraw from their friends as well. Naturally, teens may experience periods of intense sadness following loss or trauma. However, if those feelings start to last longer than 2 weeks or rise out of nowhere, that may signal depression. Teens may also have different personalities, it seems, depending on where they are or who they're with at the time. They may act one way at home and then differently at school or with friends. Teens with depression, however, they may show signs of depression in many different contexts, and they may be deliberately avoiding people and places, anything that would demand them to perform or to appear happy. So we have a brief video that we'd like to include, we'd like to present. And Maria, if you could see if that clip will work for us.
Can you see it?
No.
Okay. Can you see it now?
Yes.
Anxiety disorders are the most common mental health problems.
It's a little difficult to hear.
Some people become so overwhelmed that they can't manage their day-to-day or minute-to-minute lives. I know, one of these voices is mine. There are several types of anxiety, and they can affect people in different ways. You might have heard of specific phobia, social phobia, panic disorder, or generalized anxiety disorder, or others. Some of these seem like they might be manageable, like a fear of heights. It's not always convenient to avoid tall buildings, but you could do it. Others, like panic disorder or social phobia, might be harder to manage because they cause problems in unpredictable times, like when you're in public. Each anxiety disorder is different, but basically they all have one thing in common. They cause excessive worry that affects thoughts, feelings, and physical symptoms, and that causes problems in a person's life for at least 6 months. For me, I struggled with generalized anxiety disorder. I was worried about everything. Things I couldn't control, like getting stuck in traffic and being late for an appointment, made me really angry. I worried about what other people thought of me. Looking at my schedule each morning was the worst part of my day. It felt impossible to do everything I put on my list. This really caused problems in my relationships. I yelled at people. I know I seemed demanding and rigid. At night, I was exhausted and sad, and I cried because I was so upset. Most people with anxiety disorders also experience physical symptoms, like shortness of breath, racing heart, sweating. Some people even get headaches or high blood pressure. Stress and anxiety are very real physical problems. Eventually, people avoid doing anything stressful so they don't have these symptoms. The good news is that anxiety disorders are treatable. Cognitive behavioral therapy, or CBT, exposure therapy, and acceptance.
Okay, thank you. I don't know if you were able to hear that, but we'll talk a little bit. That was our transition into anxiety. And so we'll talk a little bit about that now. Everyone experiences feelings of anxiety at times, and it's a normal reaction to stress. When anxiety seems to be continually out of proportion to the situation and affects your teen's daily life and happiness, then it may signal an anxiety disorder. And so you'll see that some of the symptoms here are chronic fatigue, edginess or restlessness, irritability, difficulty concentrating, difficulty sleeping, muscle tension. So the key here is excessive. Is it excessive? Is it persistent? Or is it unreasonable? Excessive worry most days of the week, trouble sleeping at night or sleepiness during the day, restlessness or fatigue during waking hours, trouble concentrating, and irritability. So depression and anxiety often occur together. However, they should be diagnosed separately and treated separately, as separate issues. Social phobia. Social anxiety disorder involves an intense fear or phobia of social and performance situations. Although most teenagers go through periods of normal anxiety related to the changes that go along with adolescence, those with social anxiety disorder experience fear that is out of proportion to the situation that they face. For some teenagers, social anxiety can become chronic. It may affect their performance at school, their extracurricular activities, and their ability to make friends. There may be changes in their temperament. You want to look for in your teenager to see if maybe your teen's really quiet, like very, very quiet. If they keep to themselves, if he or she becomes withdrawn, if encouraged to talk, like they just pull back a little bit more, if they're hesitant or passive or overly concerned about negative evaluation. They fear being embarrassed or humiliated. They may keep their arms crossed. They may keep their heads down. Your teen might even make a face. Like when I used to get nervous, I'd make a face where I'd pull the corners of my mouth down. So you may notice something like that in your teen, or a nervous habit like hair twirling or fidgeting. Those may be signs that they're dealing with some increased fear that may lead to social phobia. Your teen may exhibit some symptoms at school. Maybe they do poorly at school, or he or she won't raise his hand or her hand in class. Maybe they avoid classmates outside of school. They may fear performing in public or speaking in public or doing anything that requires them to speak up in class. They may be uncomfortable in the spotlight in any form, like even sometimes the teacher talking about them or something that they've done may make them very uncomfortable. If their teen sits alone in the class, in the library, or in the cafeteria, and they're not interacting with their peers, if the teen is afraid to ask the teacher for help, or afraid to walk into class late. I know that was something that I experienced in school. I hated going to class late. Or maybe they might refuse to go to school at all and eventually drop out. With their peers, you may notice that they are uncomfortable in group settings. Maybe they're afraid to start a conversation or to participate in the conversation and they just listen. Maybe they're afraid to ask for a get together, like to initiate a hang. Maybe they are afraid to call, like even picking up the phone to call another friend. They might wait for a friend to call them, or avoid eye contact with their peers. Maybe they speak softly or they mumble. It's really hard to hear what they're saying. They may be just on the fringes, right? Like just seem a little bit left out or a little bit outside of what's going on with their peers and their classmates. Or they don't really talk about themselves. So their friends, don't really know them all that well because they don't talk about what's going on with them. Teenagers with social anxiety disorder may experience disadvantages in all areas of their life. If their fears cause them to perform poorly in school, or if it keeps them from making friends, then they may not develop the academic and social skills that they need to be successful in their future goals. So it's important to look out for social phobias. Some tips for parents with teens who have anxiety or exhibit some symptoms of anxiety disorder or social phobias. It could be difficult to know how to best support them, but it's important that you manage that or address it in a constructive way. Give your teen a chance to expose himself or herself to feared situations, but in a safe manner, or with your assistance. Don't speak for your teen. Offer praise when they do face that fear situation. So if they do face that situation that's causing them anxiety, then praise them for that, because that was tough, and it was good that they were brave and they chose to do that. Choose realistic goals for your teen, like joining a club or making a friend. Sometimes that can be helpful just to help them to navigate those goals and with your support. And you can give them steps how to achieve that goal. It's not always easy making friends. So maybe they might need a little bit of additional support in telling them what steps they can take to make friends. Encourage activities that help them to relax, like arts and crafts. It's easier when they're doing something that's relaxing. Music, yoga, and writing can all be very relaxing and help to bridge those areas. Be a good listener and let your teen know that what they're experiencing, they can overcome. Remind your teen that they've had some successes in the past. Point those out to them and allow them to build that confidence that, yeah, I can make progress in this area. Yes, I can do this. Be aware of their social media use. You want to look out for cyberbullying, predatory posts, or any inappropriate comments. Any findings should be discussed in an open and non-judgmental way. If there are causes for concern that you observe, discuss this with your teen and who they could report it to. With, whom can they discuss this issue if it's a problem? If you're not comfortable discussing what you see when you're, or what you notice from their social media, maybe ask for help from a counselor or a teacher or someone at the school, and a principal or administrator. Finally, seek help. If your teen's anxiety is becoming severe, some problems are just too big for you to handle alone. So they might require some additional support or professional intervention, and that's okay. So here you'll see in this slide the CDC's data and statistics on children's mental health. It gives us the most recent breakdown of depression, anxiety, and behavior disorders by age. There has been a steady increase in these areas over the years, and you can see that depression increases as children age, with it getting higher in their later teen years, 12, and their teen through 17 years old. As far as anxiety, you'll also see that increase here, where it goes up and anxiety increases greatly at 12 to 17 years old. And then here with behavior disorders, it comes down a little bit as they get older, and that's common as well. So how is your child coping during COVID-19? You want to invite your child to talk about how they're feeling. Feeling depressed, hopeless, anxious, or angry could be signs that they could benefit from some additional support. They could benefit from some additional support during this time. It's tough for all of us dealing with this pandemic and the unknowns and the changes, and just life is different now. So it could be difficult for them, and they could use some support. Keep in mind that adolescents and young adults may try to hide their feelings, and they might try to hide their struggles because they're feeling, ashamed or embarrassed, or they just feel responsible and they don't want to burden others. They don't want their parents to worry. They don't want to cause more trouble. Or they don't want to be embarrassed, and they just hide it. Younger children may not know how to talk about their feelings. Teens may not know how to talk about their feelings, but you may see changes in their behavior and their development. So by now you're beginning to notice, if you're looking at the slide at all, that there's a bit of a theme, right? Changes in mood, changes in behavior. So we've mentioned some of these before. So how are things different specifically for COVID-19? You might see changes in their mood that is different than normal, different than how they were before. Feeling of hopelessness or rage, or frequent conflicts that they didn't experience prior to the pandemic and being home more. You may even see changes in behavior with their relationships. So if your ordinarily outgoing teen shows little interest in texting or video chatting with their friends, and maybe they didn't do so much of it before, or maybe they did and now they're not. And so you're noticing that they're not interacting. There's no Snapchat, or they're not chatting with them while they're playing video games, or they're not making TikTok videos anymore. So this might be cause for concern. They may be experiencing some depression, or maybe even the loss of interest in activities, right? We talked about that also. So your child that used to love to cook, they were an aspiring chef and they baked every chance they got. Well, now they have more time to do it, but they're not doing it. That might be cause for concern. Changes in appearance. I'm just going through some of these because we've talked about some of those before. But changes in appearance, such as lack of basic hygiene. Okay, so many are doing a little bit less grooming during this time, so that's expected. And I promise I'm not wearing pajamas. I don't have on pajama bottoms today, but are they not brushing? Okay, are they not bathing or anything? Okay, that may be a cause for concern. An increase in risky behaviors, such as using drugs or alcohol. That's also, a symptom of depression, like we talked about before, a symptom of maybe even anxiety, self-medicating. But are they doing this now? Are they doing this more than they did before? Or even going out socializing and not wearing a mask because they don't care anymore? That may be a cause for concern. And, death, thoughts of death or suicide, which we'll talk about a little bit more. Possible complications. So some of the potential complications for a teen with depression or other mental illness include legal issues such as truancy charges if a teen misses school, or even criminal prosecution for angry teens who get into fights. Fewer college options if depression or mental illness affects their academic performance. Social isolation and relationship problems. Health problems if this causes the teens to neglect their health. If they're fearful of going to the doctor or going to the dentist, this may affect their health and cause problems, and then running away. The most serious complication of depression and mental illness is suicide. And teens who do not get help may spiral into hopelessness, increasing their risk of self-harm. Let's pause here. This is a good opportunity to just kind of take a break. We want to talk about suicide prevention, and this can be really a sensitive topic for some. So if at any point you feel uncomfortable, you are more than welcome to take a minute to walk away, mute your computer, or whatever it is that you need to take care of yourself. So according to the CDC's National Center for Health Statistics, suicide was the second leading cause of death for teens in the United States in 2018. And that's the most recent data I have. Genetic predisposition to mental illness, depression are two among many factors that influence youth suicide. As much as 54% or so of suicides are not related to mental health issues or mental illness. So just because your child does not have depression or another mental health issue doesn't mean that they're not at risk for suicide. So it's essential that the adults take depression and they take their child's mental health seriously. Here we have the prevalence of attempted suicide among high school students in 2019. And so you'll see that there's I'm sorry, can you go back? Yeah, you'll see that there's a bit of a breakdown here for female and male, and also for different races. And one notable change in 2019 was that the rates for attempted suicide among Black and Hispanic students surpassed those of white students, and the attempted suicides of white students had been higher for, as long as they have been counting this data. But in 2019, those of Black and Hispanic students did surpass those of white students. So that's interesting to note. Suicide prevention in teens. We know that depression is a risk factor for suicide, and according to the American Academy of Child and Adolescent Psychiatry, there are some other risk factors, and they may include feeling helpless and hopeless, bullying, impulsivity, disruptive and aggressive behavior, access to lethal means, exposure to violence, family history of attempts. So are there members of the family that have attempted suicide? And loss, feeling loss or rejection. So again, your teen may not have depression and still be at risk for suicide if they are experiencing any of those things as well. Just because you observe some behavioral changes in your teen, however, does not mean that they are contemplating suicide, but it is always better to err on the side of safety and caution. So some of these were mentioned before: pervasive sadness, withdrawal from family and friends, irregular activities, changes in sleeping or eating habits, increase in complaints about physical symptoms, and that could be signal emotional distress, decline in the quality of schoolwork, preoccupation with death and dying. Some new ones are talking about killing themselves and wishing that they were dead, and having no plans for the future, not talking about their future or planning for their future because they're not interested in being here for it. So ask the hard questions. Adults are often afraid that asking their child or their teen about suicide will put thoughts in their head. Instead, asking a teen if they're thinking about committing suicide will let him or her or they know that they are seen and that someone cares enough about them to give them the opportunity to talk about what's been going on with them. So ask your teen, are you thinking about killing yourself? Are you feeling sad or depressed? Have you ever thought about killing yourself or hurting yourself? Do you have access to a gun? That's a question that parents may need to ask themselves. Is there one in the home? Seek professional help. Please take your teen to a doctor or mental health provider if they've said or done anything that will cause you to suspect that they may be suicidal. Keep in mind, depression or mental illness is not a choice. A teen cannot think or work their way out of it. Depression is not a moral failing. Judgment, punishment, and nagging will not help, but may make their symptoms worse. Many teens feel uncomfortable discussing their feelings with their parents or caregivers. Depression causes intense feelings of shame and guilt, so it's important to avoid shaming them more. It's important to avoid dismissing their feelings or demeaning their emotions and belittling them. Some ways to support your teen with depression. Listen without judgment. Teens need someone with whom they can share their emotions. Don't shame them for their emotions or tell them what they need to do right away. Just listen. Focus on the positives. Many parents or caregivers have a difficult time relationship with their teen already. So sometimes it's hard to pick out those positives, especially when their pattern of behavior has been kind of taking a turn towards the negative. But despite all that, be sure to say something positive about them every day. Accepting the teen as they are. Do not tell them to be positive. You want to say something positive to them, but you don't have to tell them to, be happy or, do better, get better. Don't tell them that they need to go to a specific type of treatment or a specific counselor or a specific approach. Or don't tell them to stop complaining. It may do more harm than good. Advocate for the teen. Many people with depression, they might need to try several different treatment strategies, several different avenues for improving their mental health before they find something that works. If the first medication doesn't work for your teen or the first therapist is ineffective, then help them to find a new one or to discover something that may be more helpful for them. Who to call for help. Yes. So here's our flyer, our information about our CCP program, Texas Recovering Together at Gulf Coast Center. And our number here, you can call 1-800-643-0967, and we're available Monday through Friday, 8 a.m. to 5 p.m. And our crisis line, we have a 24-hour crisis hotline there that's also listed, and that is available to you 24/7. There's the National Suicide Prevention Hotline that's also available. There's the Texas Youth Hotline, National Suicide Prevention Hotline, and there's the website there, crisis text line. You can text any issues that you might have, and the Trevor Project for LGBTQ young people. There's the information about the state's COVID-19 mental health support line. So if you don't live in Galveston or Brazoria counties, or if you know someone who may need help and they live somewhere else in Texas, they can call this number toll free for mental health services and support and resources. And there's also the Gulf Coast Center. And the Gulf Coast Center has many services available, as you can see here, intellectual and developmental disability services, housing services. There are disaster recovery, forensic services, mental health counseling, substance abuse, physical health, veteran services, the hotline, the crisis hotline, as we mentioned before, psychiatric services for management, HIV outreach and education, and transportation with our Connect Transit. Oh, the name has changed recently. And our support groups. Our TRT program, the CCP program that Maria and I are a part of, we offer support groups. We have our young adults group that meets on Tuesdays and Thursdays, and you can see the times listed there. Also our How to Cope with Job Stress support group that meets on Wednesdays in the morning at 9 and in the evening at 7. So there's options for those of you who can't do the daytime. There's an evening option. And for the moms group, our moms group meets on, we have on Mondays, the moms in Spanish. So for our Spanish speakers, there's a moms group that meets on Mondays. And then for English speaking moms on Tuesdays and Saturdays, both at 10:30. And there is our feedback form, it's just a reminder. And we also have our Facebook Live. I don't know if you guys have ever seen it, but if you go to Gulf Coast Center Facebook page, we do live streaming on Tuesdays and Thursdays at 1. We do a book reading for kids at 1 o'clock on Tuesdays with some helpful hints for parents. And we also do our Thoughtful Thursdays, which is going to happen today. So please join us at 1 o'clock where we talk about different things that may be helpful, different topics. Today, we'll be talking about teen depression. So if you want to join us for that, feel free to do that. And we also have our Hi Hello, which I don't know if Maria has hers up, but we can share our information with a QR code, which I'm going to try to pull that up so that you guys can scan it. And we also have some tip sheets. So if you guys are interested in that, please send us an email, and Maria will put that in the chat if she hasn't already. Any questions?
I do have my phone up if anybody wants to scan the barcode, and it gives you'll be able to somehow download on your phone our information as well. So I'll leave it up here for a second if anybody's wanting to scan it.
Lisa, there is a question here. Are the mental health programs for all age groups?
Yes.
Yes.
Yes. All age groups.
Okay, and the other one is, are there any volunteer opportunities available? I-
There may be some, I know that NAMI has some volunteers and there may be some with Gulf Coast Center. I'm not sure what they are, but you could, they can definitely reach out to Gulf Coast Center to see if there are any available. And here's mine. I don't know if you guys can see that.
NAMI's always looking for volunteers as well, and they'll put you through training.
Okay, and there is a question here that says, how would one be able to tell whether their child is suffering from depression or just saying things to get attention?
Good
That's a
question.
question. Kids, if you're looking at some of the things that we talked about, do you see some of those symptoms going on with them? Kids that say things for attention need attention. So if you think that maybe they're, they may not be depressed, but they're just saying things, then take it seriously anyways, and get them some help. You can give us a call or contact your healthcare provider and ask the questions.
Okay,
Did you want to
I
add?
guess, no, I just want to say if there's no more question, I think that this is it. Thank you so much for such a great presentation. This is really good. I have two teenagers myself, and this is very helpful. So, parents, if you don't have any other questions, this is it. Like I wrote on the chat, we recorded this, and it will be posted if you want to review later. Um, Maybe after Monday, you can check on the district website under the family engagement department. We have the recording from this workshop and other that we have offered in the past. And we will continue our partnership with the Gulf Coast Center to offer more. I think that we have one plan on the stress. Is that right? On the stress management. So that one will be coming up soon and you will receive information. So ladies, if you want to say something else before we end this. Lisa and Maria, if you want to add something.
Yeah, we thank everybody for joining our workshop. Please don't hesitate to call us. Again, we do provide resources as well. I know one of the questions are there any team resources like activities they can engage in? If you're looking for, something inside the home, there's lots of activities you can do with your child, with your teen. Lisa, you have any suggestions? I think of a lot of, go bike riding and drawing. I mean, those are really good activities to help you relieve some of your stress. I think drawing, meditation, yoga. There's so many. There's a lot of youth. They love social media and internet. So if you go on a YouTube and watch on YouTube videos on how to do some meditations for teenagers as well. And this is more so teen related community groups programs. Anna, you might be able to answer that. Yeah, and related to more teen related community group programs.
Yes, I was going to, I just posted my phone number and my email. Here in Alvin ISD, we have the Alvin ISD Yet mentoring program. This is a wonderful program that we have been implementing for the past 2 years. We bring people from the community. They are willing to invest time on our student. It's a school-based program, and it has shown a great positive impact in our students from all grade. But with junior high and high school, we have seen a wonderful relationship being, developed, an opportunity for the children. So you can reach out to me and I can give you more information. You can apply for your child to be a part of this mentoring program that we offer. Is open to any student in Alvin ISD.
Yes.
Also, if you are, say you want to have a conversation with your kid, but you're not really sure of how to initiate that communication, some of the things that we advocate for or that we suggest to parents are to kind of give up control a little bit. So yes, you're busy and you have a lot going on, but maybe give your teen a power pause, like so they have an official time where they can tell you when and where they want to talk. And you'll stop whatever it is that you're doing and you'll listen without judgment. So just give them that control to just say, hey, mom, I need to talk now. I need that power pause, dad. Or have maybe a post-it discussion where you leave post-it notes with questions around the house so that and your teen can respond. They can write on the post-it. Maybe you don't, it's not comfortable talking face-to-face. So you just put it on the post-it. And maybe, you know, if a sticky note isn't something that you can do at home because it doesn't work, maybe you don't want other, you know, younger children to read what's going on with the post-its. Maybe you can use a journal or a notebook or something like that, where you can just communicate back and forth without having to sit face to face if that's too difficult. Or, you know, practice using reflective listening. So when your teen does say something, repeat back to them what they said, you know, without judgment in your tone, and just to help them to know that you heard what they said accurately. Allow them to clarify. If you're not sure what they mean, ask questions and just, you know, accept and validate what they're saying. So even if you don't understand what they're feeling, it's real for them. So express empathy and make sure that you use you and I statements.
I like what you said, Lisa. Also, I want to emphasize, you know, when we talk about staying in the present, you know, oftentimes as parents are really busy, we might be on our phones ourselves. So, you know, even when our children are talking to us, you know, we're listening, right? But we need to put that phone down and be in the present moment with that child, because they're reaching out to you for a reason, and maybe for any reason, but just doing that extra step, just putting that phone down or your, you know, the computer, whatever it is, and just stay in the present moment with that child.
And remember to take care of yourself as parents. If you are empty, then you don't have anything for your kid. You don't have anything left over. So make sure that you are getting your needs met as well. You know, take the time, have the coffee, you know, light the candle, spend time with those friends that you've been neglecting, and pour back into yourself so that you have something available when your teen needs to talk.
Right. If you can't take care of yourself, how can you take care of your child? So, especially during this pandemic and these trials that we're going through, a lot of isolation and so, and uncharted waters for all of us. So we must take care of ourselves.
Absolutely.
All right. Well, ladies, thank you so much. And parents,
Thank you
so much for being here, and have a wonderful afternoon.
Thank you.
all. Take care. Have a good one.